yield myself such time as I may consume.
The gentleman is recognized.
Thank you, Mr. Speaker. Mr. Speaker, we're here today to consider a very, very important public health bill. H.R. 3922, the Championing Healthy Kids Act. This legislation funds a 5-year extension of the Children's Health Insurance Program, known as CHIP, along with a 2-year extension of community health centers and numerous other critically important public health programs. This bill will deliver quality health care and peace of mind to millions of Americans. The patients and families helped by this legislation are our neighbors and our friends. More than 8 million children receive CHIP-funded coverage, and more than 25 million patients are served by our community health centers and other important programs. This 5-year funding of CHIP marks one of the longest extensions of the program since it was created 20 years ago. The policy we are considering mirrors the bipartisan policy that's been introduced and voted out of our sister committee in the United States Senate. Funding for these important programs expired September 30th. The committee worked on a bipartisan basis well before this deadline to try and reach a bipartisan agreement on a range of policies to offset the costs of this very critically important funding extension. 3 times at the requests of the Democrats, we delayed committee action. 3 times. We tried to find offsets that were agreeable, as we've always been able to do before. Unfortunately, that was not the case this time. These delays meant Congress went past the deadline of September 30th. While states still have rollover CHIP funds available, and the next wave of community health center funds won't go out until next year, we cannot wait any longer. Patients cannot wait any longer. Patients need care, these critical programs need funding, and we must move forward. In my district alone, there are 12 federally qualified health center organizations with 63 delivery sites. They leverage $41 million in federal money in order to serve more than 240,000 patients in Oregon's 2nd District. These health centers, and I've visited many of them, are prevention and public health in action, often serving as the main provider of care for people for hundreds of miles around. We're also extending the National Health Service Corps and the Teaching Health Center Graduate Medical Education Program. Now, Mr. Speaker, these are really important workforce programs that place qualified providers into some of the most underserved areas of our country. In addition to community health centers and the workforce programs, this bill extends the funding for the Special Diabetes Program and the Family-to-Family Health Information Centers, the Personal Responsibility Program, and the Youth Empowerment Program. These locally based, patient-centered organizations provide comprehensive services to those most in need. Moreover, this legislation eliminates 2 years of the across-the-board cuts to Medicaid allotments called for under the Affordable Care Act, Obamacare. We delay those cuts for disproportionate share hospitals for 2 years. Medicaid DSH funding represents an important component of many state Medicaid programs and is particularly relied upon by many states to help provide additional resources to key safety net providers. Now, while this relief is only temporary and does not address the larger structural challenges under Obamacare, it would give Congress time to explore what budget-neutral approaches there might be to allocate existing DSH dollars on a more equitable and fair basis. You know, in my state alone of Oregon, hospitals have told me this relief, this bill, just for them, represents $6.8 million over the next 2 years that they can use to help low-income people get access to hospital care. Now, in paying for this package, and this is the area where we have most disagreement with the Democrats, we have taken a fiscally responsible approach, like using existing funding streams for prevention and public health efforts and ensuring high-dollar lottery winners are removed from the Medicaid program so its limited resources can be prioritized for the most vulnerable, and stopping individuals on the Affordable Care Act's exchanges from gaming the system. The bill also asks Medicare's wealthiest 1%, people who are retired